Hi, this is an interview with Dr. Feby Abraham, a prominent healthcare executive and Chief Strategy Officer at Memorial Hermann Health System. Dr. Abraham plays a pivotal role in shaping the organization's strategic initiatives, focusing on enhancing patient care and expanding healthcare services across the community. You can find our article about Dr. Abraham on our website, 6degrees.blog, and our Instagram page, 6 Degrees Away. Thank you and enjoy the interview.
Yeah.
Okay, perfect. So, can you tell us about your childhood and early years? Were there any experiences or influences that shaped your interest in leadership or innovation?
Yeah. First of all, nice to meet you, Anya, and your rest of your crew at the OT school. Um, I grew up in India, and my childhood was spent all across various parts of India. My dad used to work in the Indian Air Force, and I did my schooling in different parts of India, from south to north, east to west, and went to college in India as well. One of the formative experiences I had was around airplanes. I loved everything about airplanes. Having grown up in a Air Force household, I would love to see the fighter jets. And as a kid, just got fascinated by different types of fighter jets and their design and how they worked. That got me really propelled into aerodynamics and aerospace as a area of inquiry. I love everything about fast cars and fast planes. And math. So I wanted to combine those two things in terms of working on fast cars, fast planes, and math. And that's what led me to my passion for innovation and finding out how new designs could work. What's the math that goes behind shaping all of that,
Mhm.
and led me to a career in engineering. Initially, I did my engineering in India at one of the leading schools there, and then came to Houston at Rice to pursue my PhD in mechanical engineering and applied math, also with a lens towards working in um, those areas. I saw myself at that time as a kid aspiring to either work at NASA, Boeing, or the Ferrari Formula One team.
Wow. Okay, so you talked about mechanical engineering. So the next question is, you pursued a PhD in mechanical engineering at Rice. What led you to this field, and how did your academic background prepare you for a career in the healthcare strategy?
First part of it, I think I covered through my passion in math and engineering and design and innovation that led me to that path in mechanical engineering. And I came to Rice because it had a pretty awesome program at the intersection of mechanical aerospace and applied mathematics. I also worked a lot in high performance computing, which is when you solve some of these big problems, you have to work it on supercomputers
Mhm.
and Rice had this infrastructure in my PhD program to be able for me to sort of work on some of those algorithms that were to be developed to do this in a fast and meaningfully effective way. So part of my PhD thesis was to figure out some optimal design questions in the context of these very complicated mechanical engineering or design problems in the context of computational fluid dynamics, whether it's for aerospace or for even complex fluids like blood flow. So the anchor to join Rice was with that lens to build a career there. Um, I would say, a career in science and engineering is very helpful to prepare you for anything. What I do now is completely different from what I did then. But the fundamental root cause of it is a root foundational buildup of what a career like that in engineering and math builds for you is a foundation on problem solving, to
Mhm.
think analytically, think about all the assumptions you're making when you're solving a problem. And that's carried me far, like as I solve business problems and on strategy, whether it's in the healthcare industry or many other industries that I worked on when I was at McKinsey. It all comes with this lens of unpacking a problem into its core components, then thinking about what are the analytical and quantitative insights that can help garner the right objectivity to think about what may be the solution sets that are open, and then how do you solve that.
Problem solving. Okay. What inspired you to move from a career in consulting at McKinsey to a leadership role at Memorial Hermann?
So I used to work at the intersection of math and analytics, as I mentioned, so call it the field of artificial intelligence and AI, predictive analytics. I did that at Rice for my PhD. I did a startup in trying to build calculators for eye surgery. And then I went to do a postdoc at Penn for um, creating those algorithms for in a fast way for medical robotics.
Hmm.
Then worked in a pharmaceutical company for a few years trying to develop some of these complex, fast algorithms for helping drug discovery and design problems, again, with the very similar types of problems across the board. And what I was fascinated by through all of these experiences is the the amount of impact I was having with solving those problems. But then when GSK in particular was when I was working in the pharmaceutical company, it was a large pharmaceutical company called GSK or GlaxoSmithKline. I got exposed to a lot of business problems at a higher level, which was like, hey, what drugs should we develop? What therapeutic areas should we focus on? How do we decide whether a drug is actually going to be effective for more investments or not? What companies should we acquire? And I saw myself at the cusp of providing insights or inputs into a lot of those questions. But I was fascinated by those questions. And I said, well, I'd love to be be in a career that helps shape solution of some of those bigger problems, more societal impact problems, not only at the pharmaceutical company, but at a broad-ranging strategy level. What should a country invest in? What industry should it cultivate? Um, or at a micro level, what could Blockbuster have done more effectively to protect itself against the Netflix threat? Those are the types of questions I saw myself more fascinated by. And I said, look, in order to do that, I need to sort of get more into strategy and business problem solving. Healthcare strategy came much later, but more importantly, the foundational functions of strategy and the things that go in business problem solving. And I was exploring whether I should do an MBA or should I go work at a consulting firm to be able to do that. And I was blessed enough to be recruited into the top consulting firm. And I said, oh, this is a fantastic opportunity for me to learn all of these things and help shape some of those high impact problems.
Right. Thank you. Um, you've been recognized as a top innovator. Can you share one project or initiative at Memorial Hermann or anywhere that you're most proud of and its impact?
There's a lot of problems that I would sort of anchor on, but maybe you asked for one, I'll give you two flavors of it.
Okay.
One problem that we are trying to solve for in healthcare is trying to improve the access to healthcare. How do you make sure that patients can, whenever they want it, access healthcare, whether it's a hospital, whether it is a virtual appointment, whether it's an in-person appointment. And one of the core things that we're trying to do is to think about sending the right patient to the right site of care. You don't need for everything don't need to go to a hospital. For everything, virtual is not enough. So how do you find that right architecture for sending the right patient to the right care location? In order to do that, you need to build a lot of those capabilities, whether it is hospitals, which we have a lot of at Memorial Hermann throughout Houston. But what we found lacking was in some of those other areas outside of hospitals. So outside the four walls of the hospitals, how do you build those capabilities, whether it's in virtual care, and providing easy access to patients to be able to access virtual care, or how do they get access to a in-person primary care or specialty doc at the time of their choosing, similar to how you book travel on a website or book a hair dresser appointment. Can you get like an instant appointment? And so we enabled a company called ZocDoc to be able to provide us some of those inputs. That was a partnership that we struck. And then, we went down and said, look, when you have simple situations like, you've got a cut or a sprain in your knee or a flu, should you go to the emergency room for those simple cases and wait for hours to be seen by a doc? Would you rather not go into an urgent care clinic and get yourself seen? So what we did was if you see the Memorial Hermann Go Health clinics across town, that was another innovation that we drove to try to bring a lot of those urgent care clinics. We have now 30 plus of those clinics throughout Metro Houston, which then provide a lot of access points with patients. And we have seen hundreds of thousands of patients per year trying and providing them access to those immediate appointments. And we typically see those patients in and out within 20 minutes. So that's a big innovation. It saves the time of the patient, avoiding them to sort of, bring a lot of time within waiting for an appointment or in an ER room, and they can use that time productively in those settings. I could go on and on about improving access, but that's one theme. The second theme is around the use of AI and technology to improve how nurses and doctors can effectively provide care to their communities. And so we are piloting and bringing in a lot of innovations tied to improving the experience of care providers and how they engage with patients. So, for example, we have this tool now that a lot of doctors have piloted where when they are having an interaction with a patient, those patient interactions, they don't need to sort of sit on a computer and take all those notes and then spend hours after the working day to compile all those notes into a medical note, which will then enable them to get paid. All of this can be done automatically through a technology that listens to that conversation and makes a ready-to-make note that can then be pre-populated, and they can sort of edit if they need using AI. So there's lots of applications of AI. We are both piloting and exploring for the next innings, but that's another set. There's multiple other innovations I could keep talking about, but like that's for another day.
Okay. Okay, sure. The next question is, how do strategic partnerships like Go Health or Contessa help improve patient care at Memorial Hermann?
For areas like Go Health, it's all about the first we what we do is for each of these partnerships, we try to sort of step back and say, what's the problem we're trying to solve?
Mhm.
And uh, what is the best way to solve that problem? And when we solve that problem, should we do it ourselves or should we bring another partner to help uh, solve that for us? So, in the context of Go Health, as I mentioned, it was about it trying to improve access for the patients for immediate care needs that are of lower acuity, which means that the complexity is not that high. You don't need to go to an ER, but it's immediate enough. And it's not a primary care visit in the sense that if you've got a diabetic, whether it's type 1 or type 2 diabetic, or a heart issue or something, or a cancer issue, you can go to your primary care or oncology specialist. But if you've got a flu, you've got a simple a fever or some orthopedic needs that are immediate, and you want to be seen immediately, could you go to an urgent care clinic that provides that immediate access? So our vision for doing that partnership with Go Health was to bring that kind of a value proposition to the Houston community.
Mhm.
And we then said, okay, should we do it ourselves or should we do it with a partner? And we saw that there were a lot of capabilities that Go Health had built that were much beyond what we do very well as Memorial Hermann, which is to provide the best clinical care to Houstonians, have the best doctors in Houston, run the most complex infrastructure to take care of the sickest of the sick patients. But when we do something as not as complex as a urgent care, you need a different model, which is more retail oriented. So imagine going to a Starbucks or a retail shop. You want that type of experience. And so we saw a lot of the capabilities that Go Health had brought in order to be able to do that. Similarly, there are many other partnerships we have struck. You mentioned Contessa. We have not gone live with Contessa yet, but what the thesis, the problem we're trying to solve is around does every patient who has an interaction with a hospital need to be in a hospital? Would you rather not just be at home and be provided hospital level of care for certain conditions where you don't need to be in a hospital? For example, for some very complex surgeries, when they have to be done, you have to go to the hospital because you need to have the anesthesiologist, the radiologist, and a whole bunch of specialists take care of you through the procedure. But when you're in some very well understood disease states, such as when you have, COPD or certain forms of, heart disease where you just need to be monitored at appropriate times to see if there is a need, and then depending on that, if you could you come, do you need to come to the hospital? So we saw hospital at home as a value proposition to expand our capacity and help serve the needs of many of those patients and take care of them at home. We are really thinking about the care at home model as a major innovation for the system, where whether it's virtual care for simple primary or specialty care appointments, or hospital at home for those hospital type visits, but are not as complex, where you could do it in a home supervised setup, or home health, where the patient can get discharged from the hospital, and then there could be ongoing needs that are provided within the home setting, or home-based infusion where they have to be infused with certain drugs periodically, whether they're a cancer patient or a rheumatoid arthritis patient. They need to get infusions of many novel drugs at various times, and rather than come to a hospital, could they not be infused at the home appropriately with those drugs? So there is home-based dialysis and home-based kidney care where patients with like advanced kidney disease, can they not be seen? We've struck a partnership with a company called Monogram Health to provide um, that value proposition for home-based kidney care and just taking care of the kidney care population. For the home-based infusion, we've invested in a company called Kaba Fusion.
Mhm.
For home health, we have a partnership with a company called Accent Care, that's the largest in South Texas to provide home health and hospice services for a lot of patients in the post-discharge. You already mentioned Contessa for hospital at home. For virtual primary care, we have a number of innovations, but one of them is Firefly as well, which provides same-day access to virtual primary care. So a lot of those partnerships which were struck with the notion of bringing care at home innovations, and Go Health was for the in-person innovations. We have more than 23 partnerships and strategic partnerships and joint ventures we've done over the last few years that do a lot of these things. And of course, time is limited, so I can't talk about all of them, but
Mhm.
uh, probably worth you to have a flavor of few of them.
Yeah. Okay. So data and technology are key in healthcare today, and we've already talked about the use of AI to record the conversations between some patients and healthcare givers. But what are other major like tools that Memorial Hermann has used to help patients or to help healthcare givers as well?
Yeah, I mean, if I talk about those technologies, they may seem very specific and granular for you
Right.
all, but I will always go back to, for students like you all, think about the problems you're trying to solve.
Mhm.
I will highlight four problems where data and technology are very important. One is we spend 4.5 trillion on healthcare in the United States.
Mhm.
That's greater than the GDP of India. That is greater than the GDP of Germany.
Wow.
Uh, so that's just our healthcare spend. And by the way, we have a quarter of the number of humans that live in India.
Mhm.
So you think about 4.5 trillion and over 330 million, and you're spending about $13,000 per head. That is unsustainable, right?
Mhm.
Like you continue to project that forward. Somebody's paying for it, and that's a huge expense. That's 20% of our overall GDP. So the problem statement number one, where data and technology is used, is how do I better think about reducing the total cost of care of these patients.
Mhm.
One lever in which it comes for sending the patient to the right care location at the right time. So if I can avoid a expensive emergency room visit and send them to an urgent care, and technology can help me sort of identify where to send the patient, that's huge. We already talked about hospital at home versus hospital, or home-based health care at home models versus hospitals. So sending the right patient to the right care location is one lever where technology can provide the intelligence to know which patient should go where. The second part of that is also thinking about the progression of disease. If you can early identify some disease, and then before it becomes a big deal, like for example, if you have an engine problem in your car, you want to fix it on day one, not day 100, because by the time it's the day 100, you need like to sort of do a major overhaul of the engine itself. So you want to, when you think about patients progressing through diabetes or cardiac disease or cholesterol, how are you sort of being at the front end of managing those patients through services that you provide them, so that their diabetes and their cholesterol is managed so they don't progress into the late conditions. So one level where data and technology we're exploring a lot around is reducing total cost of care. The second is around the number of humans. This is a supply short industry. I think healthcare is a great profession for kids like you to join,
Mhm.
uh, because there is the demand for healthcare versus the supply of healthcare workforce, is there's a huge gap.
Mhm.
Currently, the headline numbers are we are a shortage of about 300,000 nurses and more than 150,000 physicians. How are you going to close that gap
Mhm.
over the next 5 to 10 years, let's say? How are you going to close that gap? You can close that gap through building more new schools so you can get people educated. And we're trying to do as much of that. But we can't do that much volume of people in such a short period of time because these projections already include people that graduate through residency programs and net out the people who are retiring and so on and so forth. Technology can be a huge accelerant where you can sort of say, hey, look, some of the low value added work that the nurse or the doctor is doing, I don't need to do those stakeholders don't need to do that anymore. Technology can help and where technology cannot help, that's where they should focus. It will lead to better satisfaction and experience of of the doctors and nurses who are working today, but it'll also dramatically reduce the supply demand arbitrage, as I call it, which is the gap between the demand and supply. So that's problem statement number two, right? Which is how do you solve the supply demand shortage issue. Problem statement three is to improve the consumer experience. The way you engage with your typical consumer apps like your iPhone, or particularly the way you think about travel experience. When
Mhm.
you go and book or even your hairdresser's appointment that you mentioned, you can just go to a website and schedule that. How are you going to create a seamless experience for the patient to have that same type of experience
Mhm.
is an important factor. And that can happen in terms of scheduling an appointment, in terms of navigating the system post the appointment. What do I need to do post the appointment so can I get those helpful insights? How do I live better? Can I sort of, if I'm not doing some things, like when I use my Duolingo app, it tells me every night, hey, you want to continue your streak, right? Like, and it'll tell me that, hey, it'll give me that nudge to tell me, hey, I should sort of be on that lookout. Um, for your healthcare, is there how do we create tools like that to make sure people are taking their medications or following up on their visits with the right stakeholders? There does not exist many solutions like that. So we're trying to bring that integrated experience, financial experience. How do they pay better seamlessly, similar to other experiences? Much more cumbersome. You get tons of bills at your home today, and like, how are you going to put those things together? So improving the patient experience and thinking of them as consumers is the third area where data and technology can play a lot. And the fourth area is something that really would be the next generation of science, right? Where you bring the combination of genomics, uh, physiological data, your demographic data, a lot of this information to then better direct the care on a personalized basis to the individual. So, for example, my condition, let's say I have diabetes or high cholesterol, my outcomes may be different than somebody else who has a different condition and a different genetic profile. How do I take all those insights, do analysis on them, and come with like more customized pathways? That should personalized medicine is an area that I think pharmaceutical companies, healthcare systems, providers, payers have an opportunity to work together, and data analytics could be forefront of it. I just picked four areas. There could be multiple. There are multiple other areas that I could talk about if we had a lot of time, but that's about
Oh,
what
I
we.
actually I realized that since our schedule's messed up, I do have more than 30 minutes.
Okay,
So yeah. Do you have any limit on time today?
maybe like 5, 10 minutes over, I can go. Yeah.
Okay, sure. Okay, so we'll go through the next few questions then. What challenges did you face while introducing programs like hospital at home or precision medicine, and how did you handle them?
Each of those come with they are new innovations that adds to existing way in which work is done. They
Hmm.
are, for example, our precision medicine program is the first of its kind in Texas,
Hmm.
where or the population genomics one we launched with Helix. It basically looks for genetic screening for certain types of CDC or the Center for Disease Control type recommended diseases. And if it finds those, you can have much earlier starting of those care so that your conditions don't progress. To do all of that, you have to integrate very well with the existing clinical workflows, meaning providers, primary care physicians, and specialists have their own sources of insights to garner their information. You're adding to that. And so one of the challenges was to make sure that when you bring whenever you think about any innovation problem, how do you complement those innovations to existing way in which work is done to make it extremely helpful to achieve your end objectives is always a challenge we have to go through. The second is always to think through the financial hurdles, right? Like we live in a time where cost pressures are growing, revenues are not increasing, and therefore hospitals are have to work harder to maintain their mission to the communities. And therefore, what we need to do is whenever we bring an innovation, we have to make sure that it creates some type of societal value and can be done in a way that is financially sustainable, that we
Mhm.
are not losing a lot. We're creating the right positive financial story to be able to sustain it for time periods. So that's another challenge or hurdle that we have to go through. And the third hurdle is, or whenever you go through bringing any new innovation, any organization, there
Mhm.
will be folks, whether it's stakeholders in the community, whether it is people within an organization, they will have some set ways of doing things. And now they have to change it and change their perspective. So you'll have to influence them to bring them along the human side of the equation so they can be very well part of the journey to it. And we'll have to address some of their concerns or roadblocks. That's a challenge we'll have to go through. So those are three of the challenges we've got had to go through in some of those examples.
Mhm. Okay, why is moving towards value-based care so important, and what steps is Memorial Hermann taking to make this change?
Um, So, value-based care, what does it actually mean? Value-based care is really thinking about, you're buying a product of the highest quality, but knowing what the costs are and bringing those two things so that you get the same quality and outcomes at the lowest total cost of care possible. That's value-based care.
Mhm.
So historically, the way US healthcare worked is that they would focus on creating the right thing for the patient from an outcome standpoint, and cost was an afterthought. I mean, I wouldn't say it was completely disjointed, but it is sort of like that, right? That's led us to this 4.5 trillion cost problem that we have mentioned, which becomes unsustainable. So the true north of value-based care is trying to combine those two feature sets of getting great societal outcomes. The US ranks dead last, actually. I didn't mention this among the 12 OECD nations, which is all the top, industrialized nations in terms of several, health outcomes, lower lifespans, lower or higher rates of child mortality, higher rates of maternal mortality, so when mothers are giving birth to babies, than other OECD nations. So we are spending a lot more on healthcare, but we're not getting the great societal outcomes. So the thesis of value-based care is to combine those two things. And what we are trying to do is there are multiple strategies that go behind delivering value-based care. One is to make sure that we have got consistent quality and outcomes. And this Memorial Hermann has been at the vanguard of that throughout its existence, but we'll have to continue to push the envelope on reducing the clinical variation in outcomes. And we've been hard at work in trying to make that and making our destination centers of excellence the top rated and the highest points of choice for a variety of disease states. Um, the second is to sort of thinking about these total cost of care models. And we have created a lot of services businesses that take care of patients and navigate them so that their conditions do not worsen, or that we can manage them before like a much more complicated procedure is required. So much of the total cost of care reduction comes from two levers. One is making sure that what can be done with a safety pin does not require a hammer, right? So you can try to sort of truly intentionally manage the progression of disease so you don't require those more complicated interventions. The second is trying to make sure that you're sending them to the right care location. So when you can see them in an urgent care, you don't send them to the ER. And as I mentioned earlier, we're making a lot of investments in companies that can help partner with us to create those right capabilities to do both of those things, whether it's Go Health Urgent Care or the USPI, Ambulatory Surgical Center, or the Accent Care Home Health to create capacity outside of the hospitals in those low-cost care locations. And then for companies like Monogram that prevent people's conditions from worsening, so they don't require, in some cases, the expensive transplants for their kidney and so on and so forth, and can avoid a lot of the total cost of care. The third area is to think about whole health. So rather than just thinking about medical separately from food, from diagnosis, from behavioral health, from the medicines you eat, like the pharmacy, how do you bring all of these things to a whole health, to your fitness? And so we are investing a lot of innovations to try to bring whole health for the communities we serve by bringing all of these things in aggregate versus treating them as silos.
Okay, thank you. I'm gonna skip the next few questions and go to the last two because those are some important ones that we asked to everybody. So the first one is, what is your definition of success? And the next one is, what is advice you would tell your younger self or other younger individuals?
Um, so the first part of the question was around a definition of success. Um, to me, defining one has to set up the criteria for what that success entails. And one of for me, there are three big criteria. One of the criteria is what impact have you done through your work for society at large, right? And how are you shaping that, and what are you doing? Do you have the right big goals for what your legacy and your impact to society will be, and how are you doing that in the most effective way? The second criteria of success is what have you done to enable a great experience for your family and friends, and how are you making your loved ones and their lives better, and helping them in a big way through their own journeys and complementing their journeys. And what are you doing about that? And then the third big component of success would be around thinking about your own learning, and what have you how are you sort of as an individual growing across the various stages of life? What new skill sets have you added?
Mhm.
um, Whether it's sport, whether it's art, whether it's learning about something new like AI. Have you challenged yourself enough across a range of pursuits, whether it's academic, sports, music, entertainment, arts, or whatever it is that you want to drive? And have you challenged enough and appropriately to sort of gain all those experiences? It could also be, new experiences like traveling to new places and soaking up the history and culture. And to me, those are the three criteria. And so for each of those, I've set up some really aspirational goals. And I think going to the second part of your question, what's the advice I'd give to my younger self? One, aspire and dream big. Always keep big dreams, because even if you achieve half of that, you'll still be in a great place. And keep the goalposts really high is one part of it. The second is, just live in the moment, in whatever has happened in the past, whether, you have had wins or failures. As Roger Federer would say, every point that you play in tennis is a new point. And he made the point that he just had slightly over 50% of the points he had in his career, he won. But he won so many championships in spite of that, because to keep going at the, um, uh, you know, uh, as you look forward. The third thing is focus on your health and your family and your friends and relationships. I would continue to sort of, keep myself reminded of that. And fourth, as much as you're working hard to pursue all of this, make sure you have some way to have fun and not take it too seriously.
Yeah.
Um, yeah. So those would be the four things I tell my younger self.
Mhm. Wow. Thank you. Thank you so much. I learned so much.
I appreciate it, Anya, and hopefully you and your team had fun as well, and we'll catch up later. All right.